Hello, I'm Sui. Welcome to our very first presentation of the course, Designing and Planning Teaching or Learning Activities. There are so many doctors approaching me and inquiring about setting at a teaching session or organizing a teaching program for our undergraduate medical students. But we have to be very careful of adding any new teaching session, as their curriculum is already crowded. I know all of you are passionate about teaching, ambitious about getting higher points for your job application, and you would like to share your knowledge with our students. So we all have to make sure what we offer is what they really need. As a medical education fellow, I teach a lot. 250 sessions per year for last 15 years. It is not an easy job. I need to learn the subject before delivering, prepare the learning material, talk constantly until I got a sore throat. It is tiring, but do the students learn? If they do, how far? Just to memorize the facts for the exam or up to the level that they can apply in the real world? Nowadays, getting knowledge is that easy. Within a few minutes, they can get all the updated information they require from the internet. There is no point to teach the facts that they can get from the textbook or internet. So what are we going to teach them? We teach them how to retain those knowledge, how to update, how to recall, and most importantly, how to apply these knowledge in the real world. So what factor should we consider in designing teaching session? Yes, we consider these 5 things. Start with learning needs. Ask yourself, why these topics need to learn? Is this in their curriculum or is it a common problem? This is a global needs assessment. Target need assessment is, have our students already have this topic teaching? If so, how far they have learned? What I need to add on their pre-existing knowledge about this topic? What is the current approach to teach this topic? And what will be the ideal approach? How can I change? This is the learning needs assessment. Then next important thing is to know clearly about your intended learning outcome for your session or your course. If you don't know where you are going, how do you know if you got there? To setting a learning outcome, we use balloon taxonomy for knowledge teaching and Miller's triangle for the skills. Some of the topic they should know up to the apply, analyze, or the evaluate level. Some of them they only need to understand about it. Likewise for the skills, some of them, if they know about it, it is enough for undergraduate level. But for some skills, they could do without supervision. For example, airway management. We do not expect our F1 to deal with difficult airway without supervision in the first week of their job. But we expect them to do head chin lift. So they should know everything about airway maneuver and some airway adjuncts. What are they? How to size them? How to put it? For this higher level, we will satisfy if they remember or just understand. We are ambitious. But remember, we all have very limited short-term memory. For the students, all these facts are new for them, so they can easily be overwhelmed. Next thing we need to consider before delivering the session or designing your learning activity is what learning and teaching principle you are going to use in your session. My colleague Sarah will talk about this on the course day. Teaching and learning is a bit different. We teach them, but we are not facilitating students' learning. Today, I will give you some top tips. The best teaching and learning principle is Cobb experiential theory. Based on his theory, there are so many different elements added on it. So the educational theory says the students can learn their best by doing things in their real world with the responsibility, with well-defined learning objective, with appropriate difficulty, and the supervision with immediate feedback, chance to reflect and add on reflection. How far we offer this element in our session. These are not the new concept. Since BC 550, Confucius says so. Another teaching and learning principle is control value theory. If the students see you working and saving the patient life in the world and knowing that they are learning not to pass the exam just to save the patient life, they will involve more. Next thing we need to consider is learning and teaching methods and resources if you are going to use for your teaching course. What style of the delivery you will choose for your chosen topics and your intended outcome. We have different styles of the delivery, different resources from the part task trainer, different procedure pack, low fidelity simulation, moulage, simulated patient. We provide them with the bundle of the knowledge by giving the lecture and handouts. We provide them bundles of the skills like cannulation station, airway station, using the part task trainer, low fidelity sim. And we also teach the communication skills by inviting the simulated patient. But if we would like to integrate all of them, including the non-clinical skills, human factor, we will choose high fidelity simulation. Having said that, the best way to teach is doing things in the real world. But it is not fair on the patient and students to do the procedure and examination skills on the real patient as a first time. We should teach our students in a stepwise approach. For example, for examination skills, explain them why we need to inspect the hands, why we need to inspect the eyes, what we are looking for, what are the clinical significance of them. We can teach this learning outcome by the PowerPoint presentation in a large group in the lecture theater. It will save your time. Then we can show the video demo so they are getting used to with a step-by-step approach and familiar with the checklist. Only after that, we can let them practice on each other in a safe learning environment as a small group. Then with a real patient in the workshop or in the ward. Then we can add some distraction like confused patient, patient in pain, limited mobility, etc. The same thing for the procedure scale. For these learning outcomes, you can deliver by the lecture. For this know-how, you can deliver by sending the video and then the checklist. For show how this learning outcome, you can deliver in the using the part task trainer with a small group. That is what we needed now. Okay. And we can slowly build on that. For some skills, they got a limited exposure. In that case, we still have to provide them with some learning advance in the protective teaching area, like simulation, workshop, and various forms of the case-based learning. However, we must bear in our mind that these sessions are not to replace the learning in the real world, but to support it. So balancing is very important. The topic is math new, and the students already have a basic knowledge. In that case, we can reinforce this knowledge again and again with the increased difficulty and then move from the large group delivery style to the small group discussion. So for example, upper GI bleed patient, if the students know how to resuscitate A to E approach, and then we can check, do they know how to actually activate the massive hemorrhage protocol, how to request the blood products, and how to put the cannula in, how to check the blood product before transfusion. Then we can add, what will they do if the patient has a reaction to the blood products? Then how their management will change if the patient is a Jehovah's Witness. Another example is for the CVS examination. It is a must know for the students. So this is a simple checklist that we teach for the year 1 and year 2. And then when they begin year 3 and year 5, this is another checklist. So with the increased difficulty, more completeness, and so. Next thing we have to think about is evaluate your teaching session. How are you going to evaluate your session or your course? There are the different levels of the evaluation, starting from the reaction until how to affect on the patient. Depending on the feedback, we always modify our session. This is a dynamic process, designing the course and the designing the teaching session is. When the students need change, we change our education practice. So in summary, what I would like to tell you is, if you consider all these steps in the designing your session, your teaching session will be the best session for their learning. And your students' pre-existing knowledge, your intended learning outcome, your choice of the style of the delivery, and then the resources must be compatible. If you have any question about this session, please write it down and then I will answer on the course day. Thank you so much for listening.